the whole thing when they went home. They got extremely sick. So they ended up with tachycardia, that is the heartbeats extremely high, respiratory dysfunction, the struggles with breathing, had a lot of stress, had psychosis, and they were admitted into hospital. Okay, they actually thought they were going to die. So on investigation, what we found is this cookie that was sold to them from this shop was 100 milligrams. So you're giving an 81-year-old naive user and a daughter of 58, 100 milligrams of THC. This is why she thought that she's going to die. So nothing was explained about the dosing, cut the cookie up into 10 pieces or whatever, take 10 milligrams. And so this was completely, she's completely put off medical cannabis and thinks it's the devil. It's solely because as a medical patient, if you have a disease, guys, you need to follow a medical route, especially if you are taking other pharmaceutical medicines. So I want to talk about what is medical cannabis. Medical cannabis is used to treat a specific ailment. You have a diagnosis, you have chronic pain, you have multiple sclerosis, you have cancer, insomnia, anxiety, epilepsy. You have a specific diagnosis. The medical cannabis is produced under strict regulations. We call it GMP. So what that means is it ensures quality and potency of that product. Same like when you're taking Epilim or any other pharmaceutical product, it's controlled. It doesn't have harmful contaminants. It's not grown in your backyard. It's not extracted in your kitchen. It is free of aflatoxins, mold, bacteria. It's tested for safety and efficacy. Dosing is guided by a practitioner that understands dosing. The issue with the story, the lady, she could have had her pain sorted out if she was dosed correctly. The issue there, 100 milligram THC, never touched THC in her life, ended up in hospital. Adverse reactions are monitored. Drug interactions are monitored because I will talk about drug interactions and you are guided by a clinician. So if you have a specific medical condition, my advice is do not go to a shop that is not, they're not going to be able to give you all of these that you need, okay? That is my advice. But if you want to chase the high, and if you don't have a medical condition and you want to have a good time, by all means, that is what the shop is about. I'm talking about a medical condition that we are treating because we have such good success. At the moment that patient is put off medical cannabis, they are missing the treatment that medical cannabis has to offer. I was called to the hospital, Dr. Gallo, what do we do? Cannabis is bad. All the trauma emergency doctors, this is how terrible cannabis is. Cannabis overdose. I'm like, no man, this is because you went to a bloody shop, you bought the incorrect dose, and now I'm trying to convince this lady how good cannabis is. You know what she tells me? I will never touch cannabis, it is the devil. And it actually is not. So this is the message I'm trying to get across, is if you have a medical condition, please, please, please do this with the medical professional. So the benefits of discussing this with your doctor, it's safe and supervised. The doctor's going to give you the correct dosage form. That means if you have breakthrough pain, maybe they're going to prescribe flour for you because your pain is not helping. Oils, capsules, tinctures. It reduces the risks of other medication. There are drug interaction. So cannabis is metabolized in the liver. There's something called cytochrome P450, and it interacts with other medicines. So if, for example, if you are taking blood pressure medication, there's a drug interaction as well. You need to monitor your blood pressure because your blood pressure will stabilize, and you're not taking blood pressure meds. What's going to happen? Your blood pressure is going to drop too low. Same with any epileptic medicines. We need to monitor that. Legally and compliance, doctor now can help you with the Section 21 process. This is the only way you can legally get it for now because THC is a scheduled medicine. That means they will apply for the process, give you a piece of paper, or give you the correct information, the correct dosing. It avoids illegal or unregulated sources, like the cookie. The dosage was wrong, we don't know what else was in it, so that is how it's going to be. Personalized treatment, very important. Cannabis is not a one-size-fits-all, so you can have MS, and you can have MS, but your dosage can be completely different. Why? I will talk about the endocannabinoid system just now. Endocannabinoids are produced on demand. That means every moment the body is changing. So every single patient that our group of doctors see, we dose them accordingly to what medicines they are taking, what is the condition, what's happening in their life. It is individualized treatments. Regular follow-ups. We adjust, things are not working. Maybe the dose is too low. Let's change the dose. Microdose. Maybe we need to add something else. And that is why you have adjusted treatments. Accurate diagnosis. We know exactly what the diagnosis is. For chronic pain or fatigue, what to give you. The doctor can identify the root cause. Medical documentation. We document the treatments properly. You can work or travel with your medicines because you now have a prescription, you have a documentation, insurance or medical aids. Medical aids, I know it's another story, it's a whole different story, but funny enough, we had some medical aids pay for, actually 2 Section 21s, and they pay for the doctor's consult fee. Access to trusted products. Doctors can guide you towards licensed, GMP, lab-tested products, safe, quality. So legal requirements. You need to have a legitimate medical condition, history of inadequate response to conventional treatments. I don't agree with this. So what we allowed in South Africa, we tried to say cannabis as a second-line treatment. I believe cannabis should be used as a first-line treatment. Why wait till I kill myself and get addicted with opioids, get constipation up until here, and then I can't take medical cannabis as a better option. Other countries, it's second-line treatments. I prefer it as a first-line, but I'm just telling you what the law is. We do use flower, we do prescribe flower for breakthrough pain. I will give you some results from a study just now. Doctor determines the dose. The doctor will submit the Section 21 application. The only issue with this Section 21 is a $350 fee. It's per patient, so it's a bit of a laborious product. Hopefully we can scrap this whole story eventually, and you just get a script, go to the doctor, get your cannabis, like Australia does. That is what we're hoping for, but this is the way it is right now. The doctor will have to specify why do you need it, what is the condition. It's not a very quick process, it's per patient. And then the approval lasts for 6 months, okay? So if you do get the approval, it lasts for 6 months. So I want to quickly talk about the endocannabinoid system because you need to understand cannabis is a medicine, okay? What is the endocannabinoid system? The endocannabinoid system is a system that we all have. It's responsible for homeostasis, which means balance. It brings the body back to balance. You are actually born with a whole lot of endocannabinoids. There's 5 main ones. The 2 that we talk about is anandamide, which is your bliss molecule. This one makes you happy. So guys, you are producing anandamide, which is actually equivalent to THC, which is your happiness, okay? So that's anandamide. The other one is 2-erythritol glycerol. So in your body, you have all of these receptors all over the body, cannabinoid 1, cannabinoid 2 receptors. There's many other receptors. There's vanilloid receptors. There's PAPARs. I'm not going to go into too much detail. It's quite scientific, but for you guys, you need to know I have cannabinoid 1 receptors. If you look at the scan, the cannabinoid receptors are all over the body. In the brain and central nervous system, you have CB1, immune system, CB2 receptors. So basically, the point of this slide is the human endocannabinoid system is important to bring the body back into balance. It is a system that doctors never studied in medical school. They do not understand it. So we are now training doctors to say, this is how the medical endocannabinoid system works. This is how cannabinoids work. So CBD and THC, I will talk about it just now. We call those phytocannabinoids. Phyto, it's from the plant. So if you look at the blue, the light blue, those are your CB1, the dark blue are your CB2 receptors. When you take cannabis, CBD, THC, it comes into the body, it links into these receptors like a lock and key. So picture the THC and CBD like the key. Picture the receptors in my body as a lock, and when I take it, it unlocks the potential for healing. What that means is it's now increasing my own endocannabinoids, and that is why if you're coming for a specific disease like MS, multiple sclerosis, we are helping you with your pain, we're helping you with anxiety, we're helping you with everything, because look at it, we are bringing the body back into balance. That is it. Okay, so it is a plant-based, and we always look at plant-based medicines because isolates that you get from clicks and Dischem and stuff, they don't work. I will talk about that just now because it doesn't have the full plant extract. So I'm not going to go into too much detail here, but just quickly, THC binds to your cannabinoid receptors in the brain. CBD doesn't bind to any of the cannabinoid receptors. CBD works differently. So CBD works by fatty acid amide hydrolase, which is an enzyme that breaks down. And how CBD works actually breaks down this enzyme and keeps your anandamide high. Remember the bliss molecule, the anandamide high at different levels. That is why when we dose, or we as scientists, we look at THC and CBD and the other cannabinoids together, because if you're only taking THC, you're missing how the other cannabinoids and the terpenes react on those specific receptors, because they are working in totally different ways. They work with GABA, glutamate, vanillinoid receptors, cannabinoid receptors. It's really exciting stuff if you're a scientist, because you never end up learning more about it. But in any case, let me just quickly talk about what is the difference between pharmaceutical meds and cannabis. So pharmaceutical drugs will work on a single receptor site, but medical cannabis works on this entire endocannabinoid system level, maintaining health at the nexus of homeostasis by regulating multiple systems simultaneously. So one medicine is going to do things that 10 medicines are going to do. So now if you have multiple sclerosis, you are taking opioids, you're taking anti-inflammatories, you're taking anti-anxiety meds, antidepressants, you're taking 20 different meds, and all the side effects of that meds, and you're taking this for constipation, you're taking that for blood pressure, you're taking pantoprazole because you've got heartburn. You literally end up with 20 meds. So if you take THC, cannabinoids, full plant extract, that's what this means. Everything will come back into balance, and that is the beauty of medical cannabis. So I'm going to try and speed it up. So I'm talking about chemoverse, strains are outdated, but for those of you just getting into the industry, you would have heard a lot of people talking about indica and sativa. We no more talk about indica and sativa. We talk about chemoverse. Chemoverse is a chemotype, refers to the breakdown of plant species according to chemical composition. So why this slide is important for me, yesterday there was a discussion about depression and cannabis. So if somebody takes a chemover with too much of indica type chemover, that is, it has too much of linalool, it brings you too much in a low, it's going to make your depression worse. If you go to a cannabis shop and you tell them you're depressed, they're not going to give a rat's anything about it. They're going to give you a high THC. A high THC, it could be an indica. You're going to make your depression worse. You're going to end up in a psychotic episode. If you're on antidepressants, even worse, because there's a drug interaction between the antidepressants and the THC. So my patients with depression are not taking chemovers that have terpenes that are going to bring you on a low. They're going to be on terpenes, I'll talk about terpenes just now, that are going to invigorate you. They are not going to be on high THC because they're going to end up with psychosis. They're going to be on high CBD, high CBG, acidic compounds. So we can use THCA. Okay, so this is what I'm trying to say. It is scientific, it's medical. Don't get caught up if you're a medical patient, guys, with all the nonsense. So, okay, so let me just go back. THC, CBD, just quickly. In South Africa, THC is a Schedule 6 medicine. You should have a prescription to buy it. There is a private use, but I'm not talking about recreational, I'm talking about medical. THC will produce your higher euphoria, can increase appetite, can cause an anxiety if you take too much THC. Will cause anxiety, will cause psychosis, drowsiness depending on chemover. CBD is a Schedule 0 in South Africa with 600 milligrams with a 20 milligram dose. It's a Schedule 4 if it's greater than 600 milligrams your CBD, which means you need a prescription. CBD, there's basically no high or intoxicating effects when consumed in doses. The reason I'm saying this, CBD in very high doses can cause a bit of toxicity. It can cause a little bit of drowsiness, sleepiness, 3,000 milligrams. So again, dose is specific. THC, CBD work together in correct doses. We use CBD to reduce nausea, reduce anxiety, and sometimes it can be an antidote to THC in the correct levels. So this is a chemover. This is what a chemover looks like, where we have different cannabinoids profiles. You see the CBDA, CBD, THC. But what interests me, or what people don't understand, the medicine is the cannabinoids with the terpenes. So if you look here, my terpene profile, we talk about the entourage effect. The entourage effect is everything in the plant working together synergistically. So I got all my cannabinoids, my terpenes, my flavonoids, and that's what's the entourage effect. It's basically, if you're listening to a band and you're only hearing the drums, it doesn't sound nice. But if you hear the drums, the guitar, the singer, and all the instruments together, you make music. This is how you make medicine. It must be whole plant, extract, everything together. So if you can see I got an obsession with terpenes, so that's why I'm not going to talk too much. But the terpenes here, you can see the yellow one, for example, limonene. Limonene is a very invigorating terpene, and we would use that terpene to treat patients with depression, hectic anxiety, for example. We want to invigorate them. Beta-caryophyllene we use for cancer, myrcene we use for pain. I will go to the next slide because I said I love terpenes, and this is the secret in cannabis, the terpenes. So, thank you. So pinene, when you walk through a pine forest, you get this invigorating effect, okay? Why? It's the pinene from the pine tree. This is found in cannabis. Linalool is found in lavender, anti-anxiety, anticonvulsant. Beta-caryophyllene found in black pepper, anti-inflammatory, anti-analgesic. Myrcene found in hops. We use to treat pain, sleep aid. Limonene, I spoke to you, citrus. So when you smell that citrusy, you feel invigorated, okay? So that is the secret of the cannabis medicine. So delivery methods, quickly, your doctor will help you with this, guys, if you have a medical condition. You can take it raw, take the leaves, you can juice it, edibles, ingestion, smoking, vaporizer, sublingual, tinctures, and topical. So you have two routes of delivery. One is through the lungs, the other is through the gut. In South Africa, we allowed inhalation. We allowed to prescribe cannabis flower. It is a good thing because I had patients help for their breakthrough pain. So what happens, it goes into the alveolar capillaries, enters my bloodstream, takes about 10 to 30 minutes, lasts about 2 to 3 hours, metabolized in the lung, quick delivery. So those MS patients, they can move around quickly because the cannabis is in their body, helping them to move. So when we prescribe, we prefer the patients to vape the dry flower. We don't want them to smoke the joints. I'm talking medical, not recreational. You recreational, you smoke your joints, I'm not interested. My medical patients, if they're smoking that joint, it is burning at 980 degrees. That is very toxic, okay? You're losing 50% of your medicine. It's absorbed in minutes, you're getting toxic byproducts, it's inefficient, and it smells. Because now you're an MS patient or a whatever patient, you don't want, you're using this as a medicine. Okay? When you vaporize it with a dry herb vaporizer, it's burning at 200 degrees, 95% of my medicine, so I'm getting my survival of my cannabinoids, it's absorbed in seconds, I don't have any toxic byproducts, it's efficient, and there's no odor, okay, because I can now use it as a medicine. So guys, again, medical, important, this is the reason why. So, I'm just trying to rush because of time. Ingestion, if you're ingesting, this is important, it's ingested via the guts. So what happens, for example, THC is turned to 11-hydroxy-THC. 11-hydroxy-THC makes you high, not THC. This is the guy, okay? So this then goes via your cytochrome P450, undergoes conversion to your other parameters, and now drug interaction is important. So if I'm taking any other medicine that is now going to go get metabolized in the liver, there's going to be a drug interaction. Your doctor now will tell you, okay, if you're taking warfarin, make sure there's a 2-hour gap between THC and this. If you're taking this, make sure there's a gap, and we monitor the drug interaction. No shop is going to monitor any drug interaction you have. You're going to be there on your own. That is why this is important. So I'm not going to go through too much of this. Obviously, it affects if you're having food. The difference is, guys, if the doctor is prescribing a tincture or a capsule, remember, it takes anywhere from 30 minutes to 2 hours. Do not take more. Stick to your dose, because then you're going to be for 2 days or end up in hospital. Okay, so it can last up to 5 to 8 hours. So this is the difference between the two mechanisms and how it works in the body. Okay, addiction and overdose. Somebody said earlier about cannabis being addictive. Yes, it has the same addiction rate as coffee, 7%. Okay, caffeine 7%, cannabis about 9%, alcohol 20%, nicotine 30%. So cannabis is safer. It is not as addictive as alcohol, opioids, or any other of these medicines. Withdrawal is mild and short-lived. There is no documented evidence of pure cannabis overdose because of the brainstem receptor. It doesn't affect the respiratory function of the brain, whereas opioids will affect the respiratory function of the brain. I'm talking full plant extracts, I'm not talking synthetic nonsense, okay? What happens if you have too much THC? Yesterday there were 6 or 7 people here that got ill having stuff, okay? What should they do? Don't panic, have cold shower, ice water in the face, drink cold water, fresh lemonade, sleep it off, or we can have antidote as a CBD. Okay, so this is important that you know how to manage it, but if you're doing it through a doctor, you will be fine. Cannabis is safe. Okay, so we look at it very safe. Look at sitting at a 20,000 to 1, digoxin sitting at a 2 to 1, alcohol at 10 to 1, cocaine 15 to 1, morphine 70 to 1. So cannabis is much safer than all of these medicines here. Okay, so in order for you to die, you have to smoke or consume 1,500 pounds of marijuana in 15 minutes, which is impossible to do. Okay, so it is safe, but as I said, if you have a medical condition, make sure you're doing it via the doctor. Adverse reactions, don't mix recreational. If you're a medical patient, don't go buy nonsense from a shop. Stick to your medicine. Don't mix the two because you don't know what you're getting. So dry mouth, one of the most, we see this in all the clinical trials, all the patients. Euphoria, altered consciousness. I don't see this because we dose correctly and we know what we're doing. Acute panic or paranoid reactions, I don't see this in my patients, but we see it everywhere else here. Again, you're dosing incorrect. Altered motivation, impaired attention, tachycardia, if you're naive user, increased appetite sometimes are good side effects. And yeah, so just remember, if you're taking capsules, it takes about 6 to 8 hours that will last in the body, and it will take you about 10 to 30 minutes. So I'm going to quickly talk about this because I thought I need to squeeze this in. Okay, so we ran a clinical trial, I'm almost done, where we looked at the first ever South African clinical trial, by the way, if you didn't know. This is the kind of stuff that's really happening, the good stuff. Okay, so we replaced opioids with medical cannabis for chronic pain. We had 446 patients. At the end of the study, we had 302 patients. All these patients were taking opioids. And I'm going to just give you the results in the interest of time and make it much easier. Oh, sorry, just go back. So patients had flour and oil that came from a GMP facility. They were prescribed both. Some patients were on flour only, some were on oil only, some were on both. We used a 1-to-1 spray, that is, they had a THC of 17.5 milligrams and a CBD of 17.5 milligrams, but we microdosed. So we microdosed with 1.5 milligram twice a day. And sometimes it was different, it depends on what the patients needed. And we titrated upwards. Dosing was dependent on what the patient's pain threshold was. And then the patients that were dosed flour had 0.1 to 0.5 grams. We used this for breakthrough pain. Flour was the THC dominant flour. So I'm going to just quickly give you the results. So we had an even distribution of males and females. We had 93% patients we are able to reduce the opioids. It took us 6 months. That is huge. That is 93% patients were able to get off the opioids. Of that, 81.8% of the patients were weaned off 100% completely. And then the remaining 16.9, we were able to decrease it by 50%. So it worked well because there's something called the opioid sparing effect. What that means, it makes the opioids work better without increasing the blood level of the opioid. Means it's safer. You can never overdose. So what happens is we're able to decrease the opioids, increase the cannabis, voila, no constipation, pain is better, I'm happy, I'm able to have quality of life. These were the most common diagnoses in the trial. Arthritis was the highest, back pain, cancer-related pain, fibromyalgia, MS, accidents, neuropathy, and spondylosis. Accidents, we had a patient fall off the building, he broke every single bone in his body, he was addicted to opioids, no quality of life, came onto this trial, we saved his life. He was ready to commit suicide because we were able to get him off the opioids from the addiction, put him on cannabis, he now has quality of life. We had to give that specific patient flour as well because the oils alone were not working, so he was on flour and oil. So guys, to conclude, cannabis clearly offers significant therapeutic benefits for a wide range of conditions without substantial risks. It's important we understand the endocannabinoid system, we understand the body, we understand the holistic approach to healing. You need to take your healing into your own hands, but if you have a medical condition, please seek or source correct medical cannabis from somebody that understands it, from a facility, a GMP, that is going to be prescribed properly. We have the power and ability to heal ourselves. When you break a bone, what happens? The body heals that bone itself. Cannabis can help that whole healing process. That's what cannabis does on the endocannabinoid system. And we can ensure we can have abundant, vigorous health, guys, but you need to be able to if you have a medical condition, please follow the medical routes. And that's it from me. So we have holistic healing clinics. You can take our details down if you need to get a hold of any of our doctors. We are also international. So if you have a medical condition and you're looking for to get guided through, you can contact our clinics. We also do vitamin IV drips as well as acupuncture and medical cannabis and other plant-based medicine. So thank you guys. Thank you so much for your time. And I don't know if there's any questions.